Hey everyone over on Facebook right now. Awesome to have you here. Just checking that we've got everything working on Instagram for us right now. Just bear with me as I just double check everything is good to go. Thanks everyone again for tuning in on Facebook at the moment. Just bear with me right now. Sorry, just having a few technicalities. Okay. Just bear with me, guys, everyone that's watching us on Facebook and YouTube right now. I'm just checking that we're good to go on Instagram. Awesome. Awesome. All right. So, hey guys, welcome to the CPD Junkie podcast, #lockdown special, where every night at 8 p.m. we're bringing you interviews with dentists sharing their CPD stories and journeys from around Australia. What better way to learn than to follow those who've already done it before? CPD Junkie is Australia's most comprehensive CPD. So head over to cpdjunkie.com.au and become a member for free to access the full features of the site. I'm your host, Lauren Stone, and tonight we are joined by Dr. James Andrews. Born in Ireland, he graduated from the University of Dundee as a general dentist in 2000. He went on to complete his postgraduate diplomas in dental implants, orthodontics, and restorative. He started up a dental practice in Edinburgh, UK, before moving to Western Australia after meeting his wife, Emma. He was part owner of 3 dental practices in WA before attending UBC, University of British Columbia in Vancouver, to specialize in orthodontics, where he completed in 2018 a 3-year full-time master's in craniofacial science and orthodontics. He's a fellow of the Royal College of Dentists in Canada, orthodontics. His area of interest is in evidence-based orthodontic care and the utilization of digital technology to enhance precise diagnosis, planning, and treatment outcomes. He has since returned to Perth to work as an orthodontist and will continue his clinical research and teaching. In his free time, he taxis his 2 beautiful kids to sports, is an avid surfer, snowboarder, and a keen golfer. Dr. James Andrews, welcome to the show. Dr. James Andrews, welcome to the show. Just bear with me, guys. We're just gonna see if we can unmute him here. Dr. James Andrews, welcome to the show.
Hi, Lawrence. Thanks for having me. I'm not sure what happened there, but I think it.
It's all good. We've got you here now. Glitch. Yes. So you were a general dentist for about 15 years before deciding to specialize in orthodontics. Tell us a little about your CPD journey up to that point.
Yeah, I did my undergrad in Dundee in Scotland. I left straight from school, went straight to undergrad, and then that was a 5-year program. And then in the NHS, we get placed in what's called a vocational training scheme. So you get mentored in practice 4 days a week, and then 1 day a week you get sort of CPD at the local university, and it was actually a really good system. I felt that it sort of prepared you well for practice. Plus, it gave you a lot of experience in other realms if you were interested in specializing. And from there, I went on and did a year sort of working in Kirkcaldy General Hospital under Professor Jim McDonald, who's a consultant orthodontist. So basically, I was taking out teeth and putting on braces, and he was doing all the treatment planning. And that I learned a lot in that year alone, just doing orthodontics, sort of subliminally off him. And then, yeah, look, I traveled to Australia. What after that, life, like I always sort of intended then to do ortho as a specialty, but kind of life got in the way, and I enjoyed traveling. And yeah, I did lots of different courses with Bill Dorfman, Larry Rosenthal, Jared Seiche, the Manny brothers, all these sort of aesthetic or cosmetic courses, some good, some bad. Yeah, and then ended up coming to Australia to settle after I met my wife, who's from here.
Yeah. So, okay, let's dab on a few of those things, those courses that you mentioned. You mentioned these sound like pretty big cosmetic names, internationally even. How'd you come across these courses, and what interests you to get kind of involved in those kind of courses at the time?
Well, I was certainly always interested in aesthetics, and I think that was something. These courses were always run through. There was a program I think called Independent Seminars in London, and basically I used to travel down to London with some friends, and we'd go and watch Larry Rosenthal, for example, who's quite famous in New York.
Yeah.
And that sort of style of dentistry was interesting, but at the same time, it wasn't something that really I felt comfortable doing myself. But I always sort of looked at it as a very American thing, not really a very British thing to do. But I think that sort of infiltrated into the British market, and certainly the Australian market now, compared to what it was back then. But I really like. There's some guys like that I really enjoyed. Like Jared Seiche was very, a fantastic prosthodontist who took beautiful records, and that sort of stuff put me on a path to start looking at my cases in a different way and taking really good records. I think was one of the biggest changes to my clinical practice. It really helped me.
Sure.
And then I did an implant diploma with Crawford Bain. He was from a Scottish guy, but was a professor at Dalhousie in Canada. So I did a year with him. A lovely guy, and but actually never placed an implant, believe it or not. So yeah. So, but learned a lot, and I think that was a big thing about these courses, learning lots. But sometimes I felt competent to do things, and sometimes I didn't. And I think that's a big challenge for people sometimes, to learn what you should do and what you shouldn't do, even with the courses that you do. So
you took on implant diploma, but you never actually ended up placing one. Did you have like a one, or like, where did we start? Like from?
Well, yeah, look, I did it. I did quite a lot of surgery to graduates, and certainly did. That sort of stuff never really bothered me, and I was interested in placing implants. But I never felt I could do it as well as the specialist guys who are doing them all day, every day. I think that was the main thing. Especially if you're doing aesthetic stuff, soft tissue management is really challenging, and I just didn't think I had the skills to do it. So that's why I guess it never progressed that way, and I was probably more interested in ortho, to be honest, as well. But that was still, it was a very good thing for me to do. To actually, as far as interdisciplinary care, I learned an awful lot from it, restoring implants and stuff like that.
Fair enough.
Although I didn't place any, it's still a good course.
Fair enough. And then when you're attending all these different diplomas, do you feel like you got something in particular out of it? Like some people usually say they got out the thought process of how to process things. Or would you say you kind of developed that later on when you kind of specialized?
Yeah, look, certainly, yeah, certainly, the whole management of patients, and complex treatment planning is something that takes a lot of time and a lot of planning. And I think in the early days, you're still quite focused on procedures and like just simple one visit procedures, as I call it. And I guess doing more and more courses, you start to look at a patient as a whole and then start to join the dots of sort of different, you've got your perio, you've got your pros, then you've got your alignment issues, and then patient management skills. And I guess all these courses kind of join together to make you a well-rounded clinician. I think that's something that's really important, and I think, if you go down certainly just one line of specialty, sometimes you maybe don't get that other stuff, which is important even to be a specialist. You still need to understand the basics, and yeah, I think that's certainly stood me in good stead by doing these courses as far as ortho now.
So you feel like if you hadn't attended these other diplomas, you might have had a bit more of a bias towards a particular treatment, as opposed to having more of a holistic approach for the patient.
Yeah, 100%. And that, you certainly see, from a lot of these things, you see, ulterior motives as well. There was so much selling in so many of the courses, which kind of, it gets a bit, you can start to see through it a bit. And certainly you sort of, a lot of courses forget about the patient. And I think that's something, I think ethics is something that's really important, certainly to me. And I think that's something sometimes that's maybe not a big focus on in a lot of these sort of continuing professional development courses, and I think that's something that we should always be very reticent of. That these courses should always be for the benefit of the patient,
Yeah, without naming any ones in particular, were there particular telltale signs you kind of feel like you could tell that they were trying to sell something, as opposed to patient in mind for ethics at the end?
Yeah, well, certainly, there's certain, like, I'll give you a prime example, like Invisalign accreditation, right? So you would go to that course, and it was run by, when I did it, it was a lab in Sydney that ran the course. And it was like literally, you learn how to take impressions, take photographs, and submit a clin check. There was nothing about orthodontics. And it was all about, selling and how it's going to increase your revenue and your bottom line. And I always sort of left going, well, what it's all about just making money. That's, surely there must be more to it than that, And I think when I think about that, looking back now, I kind of see it as akin to, going and doing endo, learning about a pro taper file system, but not actually learning how to do and why you're doing endo. Do you know what I mean? So you're learning about an appliance as opposed to not learning about orthodontics. And I think that can be quite dangerous.
So you're saying like you learn about like the steps and procedures to do, but you don't actually learn about why you're doing these steps.
Yeah, the fundamentals, and I think that's like anything, if you can't make a diagnosis in any sort of sphere of dentistry, then you shouldn't really be treating it. If you can't diagnose and understand what the problem is, then no matter how well you understand how an appliance works or a computer program, you're destined for failure. And I think that's something that you've got to be very, very, very sure on, and it's very important then to get that training to provide that confidence level.
Sure. And then what for people, when they hear about your story, they hear about you've completed multiple diplomas, you started and, co-owned multiple dental practices at different stages in your career. Many people would look at you and say, you're a pretty successful general dentist, both clinically and financially. I mean, was there any doubt or any discussion with your significant other about choosing to put that aside and then committing to specializing? Because some of our viewers are probably wondering if they should specialize or not.
Yeah, like 100%. I think certainly if you asked Emma now, she'd probably still be pretty hesitant to go down. It was a massive undertaking. It was a massive decision. But I think fundamentally, I always wanted to do ortho. I think, my dad was probably a pretty big influence on me, being a professor of medicine, and kind of always wanted to, I guess maybe I felt like a bit of a fraud as well. To be honest, especially doing like more and more ortho that I was doing, I just didn't feel comfortable. And once I started seeing these cases and looking at and critically analyzing my work, I was like, I'm not that good at this, and I need to get better. And I think that it was self-driven, a lot of it. And I'm so glad now that I've done it and seen, learned how to do it properly, I suppose, so to speak.
Yeah, fair enough. So of all those CPDs that you've taken at that time, what would you say had the biggest clinical impact on your dentistry up to that point?
Yeah, like it's sort of a culmination of all the courses. I think even the bad courses, like, actually maybe almost helped me more, because you sort of start to realize it's a bit like making mistakes, right? You don't learn much by doing things right. You learn by making mistakes, and we all make mistakes, like, and those are really important mistakes to make, because then you learn from it, and it improves you as a clinician. I think the people, like, some people have been a big influence on me, as opposed to the courses. There's some people that I've really admired, like Crawford Bain, or Jim McDonald, or Hugh Matheson, or now, there's David Kennedy, or guys that who have luckily got to meet and make great friends with over in Canada, for the last 3 years. So yeah, I think you certainly, I think people are, having a good mentor is massively important in any sort of sphere, especially if you want to sub-specialize, or you've got a real interest in a particular topic in dentistry.
These people that you mentioned, I mean, sorry, I'm not familiar with them, but are there other orthodontists as well now? Is that?
Yeah, like some of these guys are like orthodontists over in Canada. Certainly, there's David Kennedy is a professor of orthodontics and pediatrics. He's a dual specialist. He's our program director, along with Edwin Yan, professor of orthodontics as well, and dean of dentistry. So a lot of these sort of guys are very inspirational, and you don't hear about these, the guys that really walk the walk. You don't really hear about them. They don't have to be big names in social media, or because but if you go and search PubMed, you'll see them pop up, right? That's where you see that. I think it's always interesting, as far as if you're always wondering about a course, and somebody's talking about, say, facial growth, for example, you want to search and see, right, have these guys done research in facial growth? Like, what is their background, or are they just sort of trying to sell a philosophy and stuff like that? So you get to see that a bit more clearly once you start to critically analyze things. And I think yeah, it's an interesting area.
Yeah, I think that's an interesting point that you've pointed out, that I'm slowly becoming more aware of, is that sometimes the courses that you're picking, you want to select those people that have a good literature publishing behind them, because then you feel what they're talking about, they're quite comfortable and know a lot about, and to your point, not trying to sell something at the end of the day.
Yeah, 100%. Like, if you I don't know if you've done a master's, Lawrence, for example. So, if I doing a 3 years master's, and certainly some of my colleagues did 6-year PhDs in, say, sleep apnea, for example. Like, the amount of work and that goes into these things, like, I don't think many people really understand the hours and hours and literature, reviews and disseminating, pulling apart methodologies. It really is thousands and thousands of hours of work. So you get a different respect for people with that sort of background, and certainly I pay more attention to those sorts of people when they talk, as opposed to I guess people trying to sell stuff.
Yeah. I mean, to answer your question, I did actually start a master's, but it was over in Kings, but I ended up having to defer it for the time being because of unable to fly back there. So,
Yeah,
but when I did do it for the first year, 100%, I would agree with you. There's so much more information. It was definitely the change in how I would approach it, and learning was definitely a big jump from where I was initially when I was just attending a lot of CPDs and trying to piece it all together myself, and it wasn't quite structured.
Yeah, no, 100%. Just disseminating literature is a really good skill to get, and to try and weed out because in every literature there's some sort of cognitive bias somewhere, and you've got to try and weed that out and try and find the actual truth or fact in that literature, and that's a real skill to get, and it only comes with practice.
Yeah. So I'll briefly mention as well, you were previously a member of the academic in British Academy of Dental or Cosmetic Dentistry. Is that right?
Yeah. I've been members of lots of different groups at different times.
Yeah.
And certainly, I think all these things are, to join communities that have similar interests, I think it's important, certainly, and be a member of the Australian Dental Association, for example, especially now the way things are going at the minute. It's a real difficult time for a lot of people, and it's important to have groups that you can that can help you through these periods.
When you're a owner of a practice, does that affect your ability to attend particular CPDs or your choice in particular CPDs?
I always find it gave me more flexibility being an owner. To be honest, I very rarely associated, I took an associateship initially in practice, but I very quickly migrated to ownership. It's just my personality. I like to do things. I'm fairly headstrong, and I like to do things my way. And I guess, certainly then I did partnerships, and I think that's something, again, looking back, probably not, it was a good experience, but I don't think I would do it again. Mainly because, unless you've got very similar sort of goals and interests, it can be a challenging thing to keep business and sort of pleasure separate, so to speak.
So, what's your current ideal clinical day look like now? The type of procedures you might be getting up to.
Look, ideally, I'm going to try and set up a practice again, probably to work sort of half the week, as far as clinical practice, just in orthodontics, and then I'd like to continue sort of my research and teaching, if I can do that in some capacity for the rest of the working week, so to speak. So that's my goal. So I'm just trying to set that up sort of at the minute, I guess.
Fair enough. And what do you hope it would look like in 5 years' time, both clinically and non-clinically? And is there,
Yeah, look, I definitely, as far as orthodontics go, it's a sort of very different way to work than general dentistry. Again, it's a lot of our time spent treatment planning, and spent with patients, and certainly I find that stuff I really enjoy that. It's like every case is like a big puzzle, and you really got to spend a lot of time working it out, and then planning it, and that takes a lot of time. As far as the actual, there's not so much procedure based stuff. I'll still do a lot of micro implants. I'm quite interested in TADs and sort of different anchorage systems, and and through my program, I've really enjoyed teaching, and I like we did a lot of teaching for the undergrads, and I really enjoyed that. So it's something that I'd like to continue in some capacity. I haven't quite worked out what that would be yet, but that's a goal for me. So hopefully I'll be able to do a bit of teaching.
Did you mention, was it micro implants that you were mentioning just then?
Yeah, we do a lot of TADs. Well, certainly I do a lot of TADs, just for anchorage. So that's something that I'm interested in. Also, my research is in sort of digital technology and creating virtual patients and things like that. So yeah, being able to use sort of combine sort of fundamental orthodontics with newer technologies, I think is really exciting. And I think for me, that's what I'd like to continue my work on.
Fair enough. I guess I would ask more, but there's probably top secret right now, isn't it? All that research stuff.
Yeah, like it is to a degree. I'm really interested in smartphone and smartphone technology and CAD design. So I do a lot of work on, for example, iPad Pro and Shaper 3D, and there's 3D facial scanning and all sorts of scanning now, and I've got like 3D printers sitting here beside me. So all that stuff I find really interesting, and it's certainly something that I think is got a lot of benefits for us going forward.
As an orthodontist, some of our general dentists will wonder, what kind of CPD courses do you end up taking?
Yeah, like for us, I guess now it's, certainly with me, I'm affiliated with the Canadian Orthodontic Society and the American Orthodontic Society. So I guess, I'll probably get yearly, go to the American Academy of Orthodontics conferences, and we've got our own UBC alumni conferences every year. Also got the Pacific Coast Society of Orthodontics and the Australian Society of Orthodontics. They all run similar sort of courses and to keep up with CPD. But I guess if you get a teaching sort of faculty position, then there's you're continually updating yourself and as far as current literature, and that's something that I'm interested in. So yeah, I think that's what a specialist sort of goes through. It's certainly always updating your knowledge. And for GPs doing ortho, it's a challenge certainly. And I did it myself. It's certainly a challenge because ortho's unlike any other specialty or any other sort of discipline, because with ortho it's not a procedure. So it's not like you come in, you do the endo, and the patient goes. It's a 3-year commitment with somebody. So you really, and it's impossible to teach that with the amount of work that you have in an undergraduate curriculum, for example. And it's very hard to even teach that on weekend courses. And I find that's a massive thing that I learned, certainly going through the program, that no matter how much you think you actually really don't know that much, which I find really interesting. And sort of, in hindsight, looking back, there's a lot of cases that I wish I hadn't done as a general dentist, which it's one of those things, but you live and learn, right?
Yeah. I mean, for a lot of the new grads and recent grads, there's a lot of aligner courses out there. There's like an abundant now, and even, grad dips that are coming out for it, What would you say to them? How should they approach it? How should they look at it? I mean, we've mentioned briefly just about how to look at some of the courses, looking at the presenters' backgrounds and all of that. But was there anything in particular you would say with aligner courses? Because that's so abundant now, and that's pretty much like the trending.
Yeah, again, I think it's fundamental. Aligner is just an appliance, right? Orthodontics is the same. The biology is the same. You're moving teeth. Anatomy is the same. It's just an appliance that puts forces on teeth in a slightly different way. So you have to understand orthodontics, like the fundamentals of orthodontics. And it's like if you want to treat a case, if you can't diagnose that case properly and then you can't give proper informed consent. So if something goes wrong and you haven't given informed consent, then you're sort of up a creek without a paddle. As far as courses go, I would strongly recommend getting a good mentor. Somebody that can actually say, sort of help you along that path of learning. And certainly doing foundation ortho is really important, but also to have somebody who can look over cases with you and sit down and go, yeah, you know what, this is a case that you could probably do, with help and mentoring. And that way you'll learn the most, and it's in a safe environment. And plus, you're not going to, upset patients, which ultimately is really important. So trying to get a good team and mentor, I think is really important. And I think there's this fallacy that all orthodontists are pretty nasty people, and actually it's not true. And I think you'd be surprised if you go and ask your local orthodontist for help to help you along, maybe treating aligner cases. But yeah, definitely learn the fundamentals first. That's what I would recommend.
Yeah. So you say learn the fundamentals first through a trusted source, and then go and speak with your orthodontist. And how would you say they would best approach it? Just give them a phone call, make sure you've got all the photos, all the cases and everything ready to talk about. Come with a plan, or kind of just wait to see what they would say?
Yeah, no, I'm a big one for professional signature. So, as far as ortho goes, it's records. Like, you have to have excellent records. So, learn to take really good records. If you can learn the fundamentals, and then, there's with study clubs now and virtual, all these Zoom networks, you can really, you can get a lot of help with these cases, with a lot of different avenues. And if you want to learn, I'd be more than happy that, if somebody comes and knocks on my door, like, I want to learn to do ortho better. Can you help me? Of course, that's certainly something that I'm a big advocate of, and I think most orthodontists would be the same. They ultimately we all have a goal to improve standard of care for our patients. So I think that's really important.
That's so awesome. Dr. James Andrews, thank you for your time today. Thank you for coming on the show. If you can let the people know how they can find you and, what's kind of going on in your life.
I guess, so, I am actually quite active on Instagram. So that's, if you're, I guess I post a lot of cases, and, I try and put a lot of evidence out there of, I guess what's called maybe more traditional orthodontics, but putting a modern spin on it, and certainly I'm very pragmatic, and I'm more than happy that anybody can reach me through my Instagram page or Facebook, or I'm happy to help anybody who wants help. So.
No worries.
Yeah.
Well, thank you everyone for tuning in on Facebook and on Instagram. If you tune in tomorrow, same time, we've got another exciting guest, Dr. Rohan Krishnan. Dr. James Andrews, thank you again for tonight. I hope you have a good night.
Thanks, Lawrence. Have a good one.